All right, thanks a lot, Michelle. Well, they are tiny, they're sneaky, and they're showing up everywhere this summer. We are talking about ticks this morning.
The CDC says tick activity is hitting the Midwest hard this year. And this morning, we're joined by Dr. Gautam Desai, professor and chair of primary care at Kansas University, to talk about how you can stay safe and be aware. Good morning, Dr. Desai.
Good morning, Crystal.
Yeah, happy to have you here. I want to start by asking you, when we think of ticks in the woods and whatnot, but where can people pick them up during the day? Because, you know, I think, oh, grassy hikes, you know, tall weeds, but where else could they be?
Yeah, so anywhere where you see grass growing, it might be around 3 feet or so tall. Maybe you're looking for a golf ball. It's your third hole of the morning, you're in the woods, you're trying to save money on that ball. These guys are sitting out there with their little hands out waiting for someone to pick them up like an unwanted hitchhiker.
Oh.
Okay, so tell us, if we find a tick that is attached, what is the proper way, how is the proper way to remove that tick?
Yeah, so there's a lot of, folk remedies where people say put Vaseline or nail polish or light it on fire, but you should not do that. You should just get a pair of regular tweezers and then grab it as close as you can to your skin where it's attached, then just give a firm pressure upwards. You don't want to agitate it or cause it to regurgitate more stuff into your skin.
Okay.
What are some common mistakes you've seen or heard of people when they try to remove a tick?
Well, everyone just freaks out when you see this thing on your body, so people will try and just like tear it off or twist its head or set the house on fire trying one of these home remedies.
Oh my gosh. Now, should we save the tick?
If you can take a picture of it, that's fine, as long as you get a good way to describe it later on or look it up later. And if you can put it in a Ziploc bag, then that's great to help identify what kind it is.
Oh, okay.
Okay, maybe we'll chat about those here in a second. But after you get a tick bite, what symptoms should people watch out for when it's time to see the doctor?
Yeah, so first when you take it off, you want to try and figure out if it's been more than a day or less than a day, if it's engorged or not. And then look out especially for a rash, any fever, chills, headache, nausea or vomiting. Those are the main symptoms people get.
Yeah, I've heard of alpha-gal too can be something. Can you talk a bit more about that and how people are living with alpha-gal today? Yeah,
a lot of people are worried about Lyme disease, but alpha-gal is a lot more prevalent here in the Kansas City metro area. And that one is kind of hard to diagnose because people get these weird symptoms. It can be months later where basically you've been injected a molecule from mammals that humans don't have. Your body tries to reject that molecule, so later on when you eat a hamburger or something, then you start feeling woozy or you might feel like you're going to pass out or something.
Yeah.
That's when you develop what they call like an allergy to meat, right?
Exactly.
And is it red meat? Is it like, could it be chicken? Could it also be pork? Does it be anything?
Yeah, it's red meat and certain specific kinds of meat. So unfortunately, it's not all meat in case you are carnivore.
Yeah.
Okay. How can we keep ticks away? How can we prevent them from entering our area?
Yeah, so great question. So the best way is really trying to stay off the higher grass paths and stay in the center of the trail if you can. And then some people will even tape down their pant legs to make sure they don't crawl in the skin. Your clothing, you can put permethrin on it or purchase clothing that has that on there. And then use an insect repellent, like DEET is pretty good.
That's a good one. Make sure it has DEET on it. I've heard that before. Got to have that for it to be high grade and effective. Where can people go to learn more about this topic?
So Missouri actually has a pretty good program, the Department of Health. If you look on their website, they have a nice thing how to avoid them, what different kind of ticks look like, and what to look for.
You know, Dr. Desai, we've known you for a long time, and we appreciate all of your advice that you come and give us here. And we know you take these trips often, annual trips, and you'll go to remote places. Like you're going to Kenya this year. You've been to places like Honduras and other parts, and you're in a very heavily wooded like area. What do you do when you go into those areas and you know it's tick infested in there?
Well, I usually use 40% DEET and then I'll check myself. So that's a good thing to do is when you come back inside, check yourself, check your two-legged kids, check your four-legged kids, because animals can bring ticks in the house where they'll kind of lurk around and wait for you as well. So always check yourself, have someone check your back or places that you can't see.
Yeah. Well, Dr. Desai, thank you for joining us. Thank you for what you do, traveling the world, providing care for people everywhere. It's very inspiring.
My pleasure. Thank you both for having me.
Yeah, good to see you.